T-points. We need a tax treaty, the tax agreement. You didn't do it. Quebec is still at the mercy of Ottawa.
Mr. Giuseppe, what about our topic?
Well, it's related to health.
It's very important. Health is very important. I'd like to talk about the economic, the Conservative Mr. Harper and the Socialist Mr. Layton, but we're here to talk about health. I'd like to add something about the Liberal plan that I haven't had time to explain. We'll help the provinces to get more nurses, more doctors. We want to be partners with them, but you also have to help the regions. There's an enormous shortage in the regions. If we refund the $10,000 of students' debt, students in medicine, when they agree to practice as young doctors and work in the regions, then we'll help the regions to get more doctors and nurses once they guarantee that they'll stay for 5 years.
Now, healthcare is a provincial area of jurisdiction. As leaders here, do you have any ideas to keep our doctors, our physicians and our nurses who may wish to leave? Are there any ways of addressing this?
We need to work with the provinces. That's critical. We will be proposing specific funding to help the provinces do things, but when all is said and done, we have to collaborate, work with the provinces. We can't dictate the results because the healthcare systems are managed by the provinces.
It's strange because you made that promise during the last federal election campaign. You promised to reduce waiting times. It's a matter of provincial jurisdiction, and yet you made the promise during the last federal election. Of course, you couldn't keep that promise because it's impossible without the cooperation of the provinces. Well, Mr. Harper, back in 1997, accepted the position as the leader of the National Coalition Organization, and what they wanted to do, what their objective was to demolish the public health system.
I can see that you're all ready to continue with this issue, but since that was directed at Mr. Harper, please go ahead, sir.
We promised to work in cooperation with the provinces and to set up programs for guaranteed wait list reductions, and now we have projects underway with all the provinces. The provinces are working with the federal government to improve the situation. That's the only way we can solve the problem.
Jack Layton.
You don't care about that. We have major problems. We are proposing something very specific. People might want to hear about it, to eliminate the debt for each family physician who makes a commitment to work as a family physician for 10 years while working with the provinces to ensure that the program operates correctly.
Well, another thing you have to do is to help the provinces to get better drug insurance. And the federal government must be a full partner here, because the care that people receive now is less and less in hospital and more at home. When you're at home, you have to pay for this yourself. We have to strengthen these drug plans, and the provinces really have to be partners with the federal government, and they'll do that with the Liberal government.
Look, we're talking about health administration. That's up to the provinces. The health minister in Ottawa doesn't run a single hospital. This is the Ottawa knows best mentality. Let's just fix the fiscal imbalance, send the provinces the money they should get, and Quebec the money it should get, and Quebec would be happy to hear ideas from Ottawa, but the people in Ottawa aren't in contact with patients. They don't really work in that field.
Public health care system, only the NDP can do that.
I want a public health system, but it's up to Quebec to decide at all times. It's not up to Ottawa to come and tell us how to do things. It's a matter of jurisdiction. No, I'm against that. I think Quebecers are against that. I think Quebecers can make their own decisions. They don't need the rest of Canada to come and tell us how things should be done in Quebec.
Both of you, Stéphane Dion.
You can't.
Mr. Layton,
please.
Would never form government, Mr. Giuseppe.
Quebec will do it. You can't do it either.
Look, can I get a word in?
You have to have confidence.
Mr. Layton, please. Going once, going twice.
Mr. Dion.
Mr. Dion has the floor.
Thank you very much, Mr. Bureau. Of course, we have to respect provincial jurisdiction through the Council of Federation. They've asked us to work as good partners. We're not going to tell them which doctors to choose, which nurses, but you have to deal with a crisis that people are suffering from every day. Every government has worked together to tackle this.
Thank you.
And that's what we're proposing to do, not to encroach.
Sorry to cut you off. Thanks to all 5 of you.